Welcome to the Surgery and Therapy Summit conversation with Cantessa Stewart, who is a certified hand therapist. Welcome, Cantessa.
Good morning.
Thank you so much for joining me today and for letting our viewers learn a little bit more about you.
Sure.
So tell us a little bit about yourself in terms of your journey to where you are today in your career.
Well, I started out as a general OT. I think most of us start out that way, and decided that I really enjoyed the challenge of working with patients who've had hand injuries, making splints, coming up with solutions to trying to help improve their motion or their strength to get them back to everyday function. And that led me to a job that I work with. Now it used to be 4 hand surgeons, and now they've grown to 7 hand surgeons in our clinic. So it's a pretty busy clinic, and we have a lot of patients that we have the opportunity to help here. So I really like my job. And recently I took the course where you're teaching the Judy Colditz technique, casting motion to mobilize stiffness. And I feel like that has really opened doors to helping patients that otherwise may not have had as good of an outcome. So
Yes, we've been working together for 5 months now.
yeah.
And what did you enjoy about learning this skill compared to all the other skills and techniques that you've been using?
I think this technique, I mean, honestly, the concepts are overlapping with many of the other things that we already know, but it puts them into a format that you see outcomes. And I think it somewhat simplifies things for patients. For example, a patient with a stiff hand, calculate how many stiff joints there are. When you use the casting motion to mobilize stiffness technique, their exercise, the amount of exercise they do is high, but the focus of the exercise is much simpler than having like a page after page of things that they're supposed to be doing with their hand. I've seen outcomes so much quicker with patients, and the progress is, I still can't believe it. I need to quit acting surprised when I see like, oh my gosh, look how great your hand is moving. I should have just come in and say, oh, I told you it was going to do that. But yeah, I really like how quickly you see the outcomes. The patients are very encouraged by it too, because most of them are frustrated with the way their hands are behaving. So I really like the technique, and it's definitely helped having you, and then there's the Facebook group that I'm a member of, to kind of help problem solve some of these cases for sure, because I'm still new to the technique and using it.
Yes, well, you have certainly invested in yourself and in your patients and in the technique by, using the resources that are available to you, particularly the mentoring sessions, which I feel are essential because it's not just about putting a cast on a hand. It's really all about the clinical reasoning that goes behind or goes into each step of the process.
Exactly, yeah.
It's very easy to get it wrong. It's very easy to second guess yourself, to make the wrong choice, and then that affects the outcome.
Mm-hmm.
So it's a real
Yeah, in the past, I mean, we used to have so many in-person courses, and they're not as as plentiful as they used to be. But some of the classes that I would have taken years ago, from strain counter strain to trigger point classes, you get a day or two with the clinician who's teaching you. And then after that, you may have gotten their email or a contact number, but communication was quite difficult. And this has been so much easier because there's been continued support at helping me hone in my skill set and making correct choices with patients, and just problem solving with other people who are using the technique.
It is certainly a journey. I mean, even after 25 years of using it, I'm still learning. And what's so exciting for me now is how I'm learning from all of you, because I am stepping into your treatment rooms virtually. We're working with patients. And so the vast application of the technique is starting to become a little bit more evident as well, just as we're exposed to so much more trauma. And you are particularly exposed to a lot of trauma with your caseload.
Yes, unfortunately, but also I get to learn a lot and help a lot of people. So
Yes,
it works out well.
let's talk about your presentation. What are you going to be sharing with us at the summit?
Well, I chose a patient to present that has had a complex injury to her hand with numerous tendon repairs and then also a nerve repair. During the course of the CMMS technique, everything that I had read about it when I was studying, years ago for the CHT exam is you use this to treat stiff hands. What I'm realizing is that not all the hands that benefit from this are stiff. Some of them have limited tendon excursion. And more interestingly, I am trying to piece together what it's actually doing to help those who have an ulnar nerve injury, more specifically in my case, and hopefully I'll have 2 cases to present by the time the summit comes around. But it's very interesting to see the outcomes. Like I had mentioned in my bio, they're quick, but also they seem to last. We've been using anti-claw splints. That's what you do. But my patients don't have a resolved claw deformity with that for months and months and months. And what I've found with this, at least with one patient, and like I said, hopefully 2, is that the claw deformity resolves quicker and goes away and stays away with the casting technique. So I was not expecting that at all. I just assumed she would have to go back into the anti-claw once we regained flexion, but she didn't have to. Doesn't need it at all. It's amazing.
It is an amazing surprise result. And I found that with combined median nerve, ulnar and median nerve injuries with spaghetti wrist patients where they've also had their tendons lacerated. And it is just fascinating how previously we thought those patients had to live with that residual deformity or manage that residual deformity with their splints long term. And also been questioning, what is it about this technique that resolves this so effectively long term? And I think it's a combination of issues. One thing that is beautiful about it is that it is a circumferential application using plaster of Paris, which is the key, versus using thermoplastics. And the main reason being is that plaster of Paris has a whole lot of unique properties that are far superior to thermoplastics. The patient cannot remove it. And so we're having that sustained positioning and the sustained appropriate force and stretch combined with movement, which is another key factor which thermoplastic orthoses don't provide. And then I think it has to do with the gypsona itself and its influence on scars, and the fact that it provides the pseudo massage, this beautiful, consistent, light touch and massage in a cool yet warm environment to the hand, consistently with movement over time, that I believe is releasing the scar tissue around the nerves and around the tendons. And if we relieve that scar tissue, then we're going to get motion and we're going to get nerve function. And because it's so gentle, we can't harm that nerve or that tendon.
Plus, I feel like there's a lot of neural re-education with it. I really feel like the cyclical movement patterns that they're performing when they're in the cast helps them re-educate maybe muscles who just aren't getting the correct information from the nerve. So it kind of translates the information so the muscle can understand it, and the movement pattern changes. It's really amazing. Not anything I would have expected to see with what I was attempting to do with the cast.
Exactly. And there's that strong cognitive component, which
exactly.
I feel integrates everything for the patient, and we're able to treat so many multiple problems simultaneously.
And it's simpler for them. It's much simpler for the patient. I don't think it's as overwhelming.
Yes, it is simpler, and they don't have to worry about any other therapeutic application, in 2 or 3 or 4 days' time, and you can leave it on their hand for up to 3 or even 4 weeks.
Yeah, I haven't found that the patients, once they see the progress, they are not as frustrated by the cast because they can see that it's actually working. And just the other day, I bivalved one, which is where you cut it and add the straps to it. And the patient was adamant she wasn't going to wear it until I showed her her progress that she had made in 2 weeks' time. And she came back in and she's like, I've been wearing it the whole time. I just take it off to shower and drive. So I think once they see the progress, they're more invested in it. Even when you do bivalve it, their compliance is much higher because they can see that it's actually helping them. And it also helps when you constantly keep showing them, their progress. Videos and photos help so much with this because those numbers and range of motion charts do not mean a thing to our patients.
They
They do
absolutely,
not.
yeah, I agree. And it's the only true effective way of demonstrating that change in the tissue.
Oh yeah, pictures.
Yeah, and I mean it's just beautiful because a claw deformity is very frustrating for a patient. Never mind the muscle atrophy that's associated with that. Have you noticed a decline in muscle atrophy with your claw deformity patient?
I don't know that that is a question that I can answer because the first patient that I used it on that will be presented, she was already 4 months post-op. So atrophy, her whole hand was atrophied. And she definitely has some Sums-Weinstein deficits as well as a positive Frohman sign. So in her case, the atrophy was well in there before I started the Sims. Now, the patient that I'm just starting, she's only 6 weeks post-op, and it was just an ulnar nerve contusion. It wasn't even a laceration or a repair, just a contusion. And she does not have atrophy. Hers is more of just a horrible claw deformity that doesn't even truly resolve in an anti-claw splint. But her photo updates each day since application of the cast 3 days ago. She has full IP extension in this cast, and she did not have that in her anti-claw splint. Granted, the cast is, she's admitting that it's bulky, but she's excited that her fingers are actually like responding to what she's telling them to do. So she's fine with leaving it on there. We're aiming for 2 weeks, and then we'll bivalve it to see how much of the deformity has resolved. So I'll have pictures of that in my presentation so we can kind of track it.
I think what will be good is to collect these cases and then we can publish a case series report and we can look at the similarities and the differences and then also be able to look prospectively and retrospectively at any additional changes like the muscle atrophy and any gains or any kind of potential loss or lack of loss of atrophy. And that's the beauty of an observation. It's the start of something that can contribute towards the literature in time.
Exactly. I'll need some guidance on that. There's a couple of cases that they've been so interesting. And I've, honestly, there's always more to learn. But in 23 years, I've seen a lot of different things. But the outcomes with these patients have really been eye-opening and kind of reignited something that as we get further into our careers is harder to maintain. So when you learn something new and you see these outcomes, it's pretty exciting. So I do think writing it up would be quite fun. Hopefully my second case goes well.
It is fun and it's your next challenge. It's a rite of passage.
Yeah, maybe. We'll see.
Well, we are so fortunate to have Aviva Wolf, and we're going to be beginning our journal club, writing club in October.
Yes, I need that.
And that's official. And we're just so blessed to have somebody that has so much experience in publishing and can guide us and inspire us to get our work published a whole lot sooner, particularly with this technique, because there is only level 5 evidence and it should therefore not be disregarded. We just need to build on it.
Mm-hmm. Yep, exactly. I mean, we're seeing the outcomes, so we just have to put it in a format that everyone else can say the same outcomes that we see, and it backs up the technique and its validity in our clinics for sure with patients.
Yes. And one last question. How have your surgeons responded to you using the technique? Have they enjoyed seeing the result? Well, I'm sure they've enjoyed seeing the results, but I suppose what I'm asking you is, have they been concerned about the immobilization?
No, that hasn't been a concern at all. I actually have another patient today whose cast was 5 out last week, and he's seeing his surgeon today, and he gained 20 degrees of flexion in his MP joint just in 2 weeks' time. And in the previous 6 weeks that he had been working with other therapists, no change. unresponsive tissue. So yeah, they're not concerned about the immobilization. I haven't had any ill effects from the immobilization. So they're not concerned about that. That wasn't the biggest thing is I think just explaining the technique, make sure you're including whichever doctor you're using and telling them what you're doing. I don't do it without talking to them first, just because it's their patient.
Absolutely. And you don't want them getting a fright when the patient comes back in a cast and they don't understand
Yes.
what you're doing, why you're doing it.
Yes. Yep. Yeah, exactly. No, they've been on board and supportive.
Oh, well, Contessa, all I can say is that I'm immensely grateful to you for taking on the learning journey, for participating, and for also just showing us a whole new result that one can achieve with the Sims technique in terms of using it with patients that have nerve injuries, particularly the claw deformity. And for being a presenter, we look forward to your presentation. And we're also going to be doing a panel discussion with 3 other therapists, which I think will be very informative and interesting to our audience.
Yeah, I'm kind of excited that the whole technique has proven to do more than just treat patients who have stiff hands. That was not something I anticipated. So this is definitely an interesting technique to learn and figure out, and I'm excited to see what else it can do.
I think it's the sky's the limit for you.
It's been definitely fun. I needed something to revitalize work. So
Yeah.
this has made a big difference. So
Oh,
thanks for your help. I appreciate you teaching this because I never quite grasped it from reading the articles and the chapter in the rehab of the hand. But this has made it make a lot more sense to me.
my idea was always to bring that chapter to life, to have it, to develop the community and for everybody to learn it in a structured, organized manner, something that's taking you also on a journey of understanding the influence of the stiff hand and how one can go about managing the stiff hand effectively in the most time efficient and cost effective manner. And so it's really just my pleasure because all of you keep me inspired.
Yeah, and if you've ever been to a course, which I'm sure you have been with Judy Holditz, her courses are very structured and very detailed. So she definitely uncovered something huge with this, and hopefully the outcomes will make her proud.
I think so. Absolutely. Well, it's her legacy. Uh,
Mm-hmm.
I was
Definitely.
I was so fortunate to have Judy as my mentor, and over the years to present at different conferences and on different, live panels and discussions. And absolutely, it's that attention to detail, the attention to the anatomy, and the quest to understand why it worked. I mean, Judy's knowledge and just the reference list is absolutely enormous. One can
Yes, 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 yes.
the hand and to kind of assimilate all that information. And I do feel that we our career and our profession owes so much to her. So I'm certainly in gratitude to her and for allowing me to carry the flag and continue to share and teach with all of you.
Yes, exactly. Big thanks to both of you.
Thanks, Contessa, and thank you for joining me today.
Thank you. Have a good day.